Hi all. So yesterday we have learned about headaches due to indigestion, nervous headaches, and reflex headaches. So today let's understand about, as I have already told, different headaches have different kinds of treatment. Nothing works same for all the kinds of headache. Today let's understand more about neurologic headache, anemic headache, and cluster headaches. Coming to neurologic headaches, irritation and inflammation of the facial nerves above the eyes, on the cheeks, and on the jaws. So this causes neurologic headache. Lot of inflammation happens on the facial nerves, especially above the eyes. So if at all you have got pains above the eyes, on the cheeks, and even the jaws have started paining along with the headache. So this is called neurologic headaches. This usually happens because of loss of sleep. Loss of sleep aggravates this kind of pain, which persists for sometimes until you end up having nausea or vomiting starts happening. And this kind of pain usually extends to the back of the head also. So with just nausea and vomiting, this kind of headache starts reducing. This is as simple as that. So the best remedy for this is good sleep. Good sleep, deep sleep. If sleep has, if you have issues related to sleep, there are a lot of things which can be taken up, especially loss of sleep due to stress can be managed very well. Something like chamomile tea can be taken after the dinner. Something like, a good amount of magnesium can be taken, so that magnesium through food also, and magnesium through organic supplementation also can be taken, so that you get into deep sleep. Okay, so this sleep alone and reducing stress alone can reduce this neurologic headaches. And the next kind of headache is anemic headache. So this usually happens for the ladies who are in their reproductive stage. Anemic conditions, it causes a kind of dull and nagging headaches, which is usually followed by anxiety, palpitation, giddiness, and depression. This usually occurs in girls and women due to loss of blood during the menses. So your hemoglobin levels should be in the optimal range. Usually when we see any blood reports, if at all in the blood reports the hemoglobin level says it is 11 or 12, okay, I'm not anemic, right? Why should I take iron supplementation? Why should I increase my iron content in my food? You can ask this, but 11, 12 is not optimal for everybody. For some ladies or for some girls, even at hemoglobin levels 9 or 10, they manage very well. They don't get this kind of headaches. So for somebody, even if it is 12 and 13, they get this kind of headache. That means for that person, the optimal level of iron is higher than others. So at a range of 13 or 14, anemic kinds of headache reduces to many girls and women. This we have observed very well in a lot of ladies who are in their reproductive stage. By correcting their hemoglobin levels, not by taking synthetic supplementation or animal sources of iron supplementation, natural plant-based supplements, and along with that, increasing the amount of B12 in the body. If B12 is not good, iron is not absorbed well. Like how if your vitamin D is not good, how much ever calcium you take, it doesn't get absorbed in your body. In the same way, B12 should be very good levels so that iron gets absorbed. Otherwise, how much ever iron supplementation you start taking, your iron will not absorb and you remain anemic, and we'll start going into some other treatment options. But the root cause is a low B12. So why B12 becomes low? Again, if liver is unhealthy, gut is unhealthy, B12 goes low. If B12 is low, iron is not absorbed. If iron is not absorbed, it ends up in headache. So wrong diagnosis will happen. So we start taking some other kind of treatments. Maybe we start taking migraine tablets. But the simple reason is anemia, right? So work on your hemoglobin levels. If anybody is anemic, girls, young girls, and ladies who are in the reproductive stage starts getting headache, check your hemoglobin levels, get it into a very good levels. Not 11, 12 is not enough for some people who have headaches, but for others it is absolutely fine. You need to increase your hemoglobin levels, let it be 13, 14, 15, and then start observing how many days you start getting headache. Okay, so and usually these kind of headaches happens just before the periods or after the, usually after the periods, maybe 8th, 9th, 10th day, this headache starts increasing. You can observe that, mark the date, start observing what kind of symptoms are you getting, when are you getting those symptoms, and how is your blood work, and you can treat this anemic headache very well. The next kind of headache is cluster headache. This type of headaches affects usually the adolescents more than the adults. Uh, it affects adolescents, and it appears and disappears periodically but regularly. And as it lasts for a few days, it reappears after a period equal to the duration of which it had lasted. So mostly these headaches occur sometime after falling asleep or just upon rising in the morning. Sudden pain wakes up one from even sound sleep. Such headaches are usually one-sided headaches. It causes one-side discomfort. And redness of the eye and throbbing pain on one side of the temple. And some of the other types of headaches are psychological headaches, headaches triggered by dental disorders, dilation of arteries. Okay, so cluster headaches, again, cluster headaches usually cluster headaches will take a little more time compared to other kinds of headaches to treat. So how is the treatment for cluster headaches? Since it happens periodically, what we have observed is there is some deficiencies at the cellular level. So at the cellular level, at the mitochondrial level, there is some deficiencies. So this we have to correct with proper micronutrients. When this is done, cluster headaches, finally it reduces and headaches are reversed completely. So we need to focus more on the micronutrients, which is at the cellular level to treat this kind of problem. Hope this information has helped you. Thank you so much.